Thank you. So we are back in Senate Government Operations. We have made an attempt to get somebody from the Department of Health and DFR, and my contacts, I wasn't sure who to contact except for the commissioners, which I did, and have not heard back from them. My guess is, as Kendall said, that they're probably in meetings on the road. Dealing with a COVID crisis. I don't know where they are, but I have not heard back from them, nor has Kendall. So what I would suggest is that, and just I'm going to ask Kendall. She has some information to share with us, but first I'm going to say that I had misunderstood our role here, and I just did hear from the pro tem and the secretary of the Senate. We are not officially back in session yet, so we do not have possession of any bill. We are, our purpose in meeting was to, excuse me, was to kind of look under the hood and get as much information so that when we go on the floor tomorrow, officially, we will
Monday.
Monday. We will be able to answer some of the questions and give some information. We will not vote on anything today in this committee. So I had misunderstood that, but I just wanted to make that clear to all of us.
So where does the bill originate? Do we still need to get a bill out, or that bill is coming from the Rules Committee?
I don't know where it will come from. My intention is that I'm going to report the main part of it, and then anybody else can say whatever they want to. Tucker, you may know where it will come from. Will it come from the Rules Committee, or will it just be out there?
You should probably ask for backup confirmation of this from your parliamentarian, but I believe, Senator White, that this will be introduced by you when the session opens and will be taken up for immediate consideration. That's my understanding of how it would operate under the Senate rules.
Okay, and so I'm happy to do that.
What you've all been talking about and considering today is a draft of a bill that has not yet been introduced.
Okay. Thank you. Okay. So, yeah.
I mean, I could use some clarification, but I don't want us to spread any misinformation if we don't have the accurate information. I'm just wondering if anyone on here knows if that means amendments cannot be considered. I haven't really heard of a special session where you can't consider any amendments. So is it that you would introduce a bill and then amendments can be considered to that?
My guess is that, yes, and I think that Senator McDonald intends to put an amendment on, and that is the way I understand it.
Okay, I had gotten very worried that if something didn't come out of committee today, it couldn't be considered unless Rules released it for consideration.
I think that a separate bill would have to, I don't know, maybe somebody could introduce a completely separate bill during the session on anything they wanted to, and that it would be there and introduced, and it could be even brought up and debated, but we will not have rules suspensions. I do know that for anything other than this.
I think theoretically somebody could offer an amendment that really totally transforms the existing bill. So that would be one way of introducing another bill. Just do it as an amendment if somebody's, that's probably possible. I'm not saying it's going to happen, but.
Yeah, that would be the way to,
And for Jeanette, for us to consider an amendment, we would probably take a time, break briefly for the committee to consider an amendment, don't you think?
I don't know, because this isn't coming from the committee. This is just coming from me.
Right.
No, but once we have debated and discussed the body of the bill, and an amendment is introduced, or two amendments, I would assume we would break to consider those amendments and make a decision and vote as a committee about that or not.
I don't know. I will check with Bloomer to just see. I'll send him an email right now to ask him about that. But my guess is that since it isn't coming out of any committee, and this committee has not voted to support or not support the bill, that any amendment would just be debated on the floor. It wouldn't come back to our committee or health and welfare or transportation, because none of those committees have approved the bill.
So in preparation for Monday, for an amendment where we have not been able to hear from the administrative departments that oversee those areas of expertise, DFR and DOH, how would we need to pursue finding out what an additional, whether they're able to meet, whether they're able to meet those expectations in an amendment. I mean, I think we need to find it out if they're able to do, I think we need to do some.
I think we can do some. We can look at some things, and Kendall has something for us. But I think that anybody who wants to put an amendment on, because of and I will send Bloomer a note and ask him this, but since this is a special session and the bill isn't coming from any committee, our committee has no more interest in supporting or not supporting an amendment than any other committee. So we could, I don't think we would take a break. I think that anybody who offered an amendment, whether it's the one that Keisha has or Anthony's suggestion that somebody could offer an amendment that completely that just calls for a statewide mandate, that's all. And it would be up to whoever offers the amendment to provide the testimony that would convince 29 other people to vote for it, or for people who oppose the amendment to offer their evidence to convince 29 other people to vote against it. I'm not sure why this committee would have any more to say about that amendment than, say, health and welfare. I mean, we can, because we are here now and because it's been proposed to us, I think we can have some discussion about it.
Right,
but
right.
I don't think
yeah, I'd support that because I think we need to fully understand the impact on DOH and DFR, and if it's possible to get this information updated daily.
But that's because the five of us have an interest in, and it's being presented to us. We're not going to vote on it. We're not going to vote on the bill. We're not going to support or not support. It'll just give us additional information for the floor discussion. I think that's the way I understand what Bloomer has told us. Does that make any sense?
Yes.
Okay. And we could have other bills also introduced, and who knows what will come up. We'll probably be there till Friday. Okay. So with that, I would ask, I had some questions over the break when I sent the emails to the commissioners, I did pose a couple questions in there that they might want to think about. And so I would ask Kendall to give us what she called a tidbit of information, but I suspect it's a bit more than a tidbit. But if you would like to give us the information that you have.
Sure. Again, just to renew the record, my name's Kendall Smith. I'm Governor Scott's Director of Policy Development and Legislative Affairs. It really is small. So like I had relayed, I have had trouble getting in contact with Dr. Levine and Commissioner Pichek, who the committee was talking about hearing from around 12:30 on the proposed language from Senator Rom Hinsdale. What I can say is that the administration will and is prepared to do anything we can to give as updated information to towns as possible, which is something that we currently do. And I know Peter and Karen and others just talked about that at a very high level, or others throughout the morning conversation. The limited amount of information that I do know, which again, I just want to be very clear that I would defer to VDH and DFR on this, but is that the data gets analyzed and scrubbed and reviewed very closely before it's posted, and that there's reasons, epidemiological reasons and other reasons why knowing the day-to-day information is great, but looking at the overall trend for making decisions is important. And so right now, I mean, that's how the administration's been looking at the decisions the governor's been making over the course of the pandemic, is the long-term trends. Because as we all know, daily numbers go up and down, but looking at kind of, you know, what is it doing? Commissioner Pichek shows his graphs at those weekly press conferences is important. So that's what I have. It really is quite limited. But again, I do want to say that we do strive now and will continue to strive to get towns in as real-time information as quickly and thoroughly as possible at any point now and going forward.
I guess I would, oh, yes.
No, go ahead.
No, I was going to ask, I don't see Karen here, but I do see Peter and Carl, and just was going to ask them what value there would be in having the day-to-day rates as opposed to a trend rate. If Brattleboro had tomorrow 7 cases, would you then call a special meeting and do that? But then the cases went down for the next 5 days and you only had 2 or 1 for the next 5 days. Would you look at trends, or would you look at a daily, take action on a daily count? Yeah, Peter.
Thank you, Senator. So we would not convene a meeting based on one day's information. I think it's very unlikely we would make any decisions based on individual daily counts. The point's been well made. The trends are what are the most important thing. Where are we headed, and to the degree that experts can help us understand why are we headed in the directions that we're headed. From the direct answer to your question is we don't need daily information to make the decisions that we as local governments, is my opinion at least, that we as local governments would be making if we're empowered to under this bill. I would say, though, that I hope you will support Senator Rom Hinsdale's amendment for the purpose of impressing upon the state officials the essential nature of the data that they're working with for decisions that we will need to make. I heard some of you talking in your discussion prior to the break about, you know, if we're going to be empowered, if we local government officials are going to be empowered to exercise this authority, then you want to make sure that we're exercising it based upon the latest, best available information. So frequent updates and easy access would be really appreciated. Exactly how that's provided by the state, how it can be provided, how it would be provided, you know, I don't particularly have an opinion about.
Thanks, Carl.
Yes, thank you for the question. I agree with Peter that frequent updates and good data are helpful. I started a radio show at WGDR in March of last year. It was a daily news show about community and the pandemic. And I was, I think, the first show in the state that reported on a daily basis a 7-day rolling average for COVID cases. And I calculated those myself based on data from for the daily reporting rates from the state website. I think trends are important. And as Peter said, there's fluctuations up and down that are just noise. And I would repeat what I said this morning, that I am, as a municipal official, I'm more interested in what's happening in Washington County than in East Montpelier in particular. East Montpelier is home to U32, 7th through 12th grade. There are 4 other towns that send students there. I don't know how many towns the teachers come from. We have people in East Montpelier who work in Montpelier and many other places. We're a very porous border in East Montpelier, so I'm interested in what's happening in the county as a whole.
Okay. So I guess I don't have it right in front of me again, but I think it says that there should be daily updates for county and towns. And my question is, I don't know how often right now they update the information, but the information seems to be probably a few days behind because of the process that Kendall talked about. So even if they did daily updates, it still wouldn't be the daily count. Mm-hmm. So what are we interested in here in getting? Are we interested in seeing what a weekly trend might be in a county, or do we really want daily updates from every town that reflect that days, or the 3 days beforehand, because it takes 3 days to actually get the information, as Kendall, I think, her terms were reviewed and scrubbed or something like that, so that they make sure that they're looking at the right data. What is it that we're actually trying to get at here?
So,
yeah,
I mean, I think the navigability, maybe I didn't emphasize how important the navigability is to all of this. I mean, there's some data that's a week and a half old. There's some data that looks like it's up to date as of yesterday. There's some data that's a 2-week average. There's some data that's a 1-day information. There's some data that's based on the town. There's some data that's based on the county. If you are the average resident of a community who wants to ask for a change in masking policy, if you are a town manager who is trying to make sense of this and help your community make sense of it, it's not particularly easy to look at that and identify the transmission rate, the guidelines, and the data in your community and county in the same space. You have to go to lots of different places, and it's all different information. I'm not saying that they're probably not doing their best. One of the reasons that I thought maybe digital services would be helpful to hear from is because I don't know the last time they did a user experience analysis of using that information. There are academics who use it and probably can dig deep, but there are people who need lots of information, who have to move very quickly and navigate things quickly, or who don't have a significant digital literacy. I'm having trouble reading the information. And if I'm having trouble, then the average person who doesn't have a significant amount of time or digital literacy is probably also having a hard time looking at that information and understanding what is best to keep them and their community safe in real time. So I think we tried to draft it in a way that doesn't necessarily change the content that they're trying to get out every day. They would still need to make sure it's scrubbed for quality and confidentiality, but that it's far easier to see some of these things side by side and make sense of them as a community and be able to assess both trends and, urgent sort of escalation of cases.
Okay, any comments? I don't know how, because this is directed at the Department of Health and at the Department of Health. But if it's a navigability issue, is it the Department of Health or is it somebody else? And how do we, I guess I haven't looked for this information for my town. So I don't know how difficult it is to find. I know that Karen said you can find it and it's right here. But I might have misunderstood that. So how hard is it to find the information, Peter?
I can only speak as, one user, but what I've tried myself and what my colleagues in Brattleboro have tried in terms of using VDH's site is exactly what Senator Rom Hinsdale described. And as a result, when we have been considering these matters, we've been relying on the CDC website, which has good information. But it's the county information. It's not at all granular. I don't know how up to date it is. So the idea that we might find something that is as user friendly, might move on to something here in Vermont that is as user friendly as the CDC's site, but with information that we can count on as having been vetted by Vermont authorities, feels really right to me. That would be a good improvement for all of us.
So what we're asking them to do is redesign the way they present their website with the information, and to make sure that it's up to date. And I'm not sure what that means. If that means, I don't know what that means.
Carl has his hand up, but I don't think the
Oh, there he is.
Changes their current practice. We can obviously get that information from them, but I don't think we're asking them to, they have lots of different information updated at different periods of time, some showing trends, some showing the information they try to present every day. It's, if you're not fully literate in what you're looking at, it's actually very hard to tell what time frame you're looking at and how to compare across time frames.
Okay.
And I'm speaking as someone who considers myself pretty digitally literate. I'm having a hard time doing that as I'm on the website.
Carl?
One of the parts of this amendment that I think is particularly valuable that I don't think has been discussed much yet is tying the Vermont data specifically to the levels of community transmission that the CDC uses in issuing its guidelines. So right now, I haven't tried to do this lately, but in all the previous times that I've gone to the Vermont website, what I've needed to do that is look at, okay, how many cases do we have, say, in Washington County? What's the rolling average? Okay, what's the population of Washington County? Okay, divide those number of cases by 60,000, whatever. Okay, and then look up, okay, what's that on the CDC's transmission table? Whereas the CDC's website is very clear. This is a color that corresponds to this level of community transmission according to our guidelines. And as Peter said, maybe we don't know how well vetted those data there are compared to what we have from our own Vermont Health Department. So let's have the close to home data that have been vetted by our own officials translated into a language that makes sense in terms of CDC guideline levels.
Okay, so really what we are asking them to do is redesign their website. We're not asking them to change what they collect or how they report it, but just to, not how they report it, but what they collect and how they scrub it or anything like that, but to redesign their website. That's what we're asking them. Right?
I wouldn't say redesign their website because that's a whole different kind of job. We want to redesign this part of the website.
Yeah, that's what I meant. I didn't mean their whole website. Yeah.
And improve it. I think improve it for all the reasons that were just mentioned. It's not so much I guess that's a redesign, but we want them to improve the quality and timeliness of the information they have on their website. And the consistency, as both Peter and Carl mentioned, the consistency, and make it consistent with the CDC presentation on there, so that we all know what red means. We all know what yellow means. We all know what orange means.
Okay, so, okay. Any comments?
I don't see any, from this conversation, I feel like someone in the administration could watch it and understand our intent. I don't see any language in the bill that is misaligned now with where we've gotten to with this. Kendall might be listening in. I do think this is a valuable piece of policy here to help the residents and policymakers and decision makers in different communities consume quality data and use that to make informed decisions if we're putting these decisions in their hands.
Yeah, I think that is really the intent here, is to, if we're going to give the towns this authority, we want to make sure that they have the best and information available to them to make that decision. That's why I think this is important.
Okay.
We could like direct I'm looking at Karen, who's probably going to do something with her eyes at me, but you know, we could direct the Agency of Digital Services to work with Vermont League of Cities and Towns and partners to make this a more useful tool. I mean, I can think of ways to talk about how you change the value of the navigation of the website, but do it in partnership with town leaders and, you know, like Board of Health leaders in towns who want to help make decisions. And I think eventually what that will do is also make it easier for regular Vermonters to look at it and make decisions for their own family as well.
Senator Collmore, you had a.
I did. Thank you, Madam Chair. Perhaps I misunderstood earlier, and Peter has since testified additionally, but I thought I heard Karen and Peter both express contentment, if you will, with the current situation in terms of reporting. And I'm trying to understand what this amendment would give us that we don't already have. So maybe I'm not as digitally competent as I should be, but I at this point, I'm not going to support the amendment.
So Peter.
Thank you.
And then Karen.
Senator, I appreciate you asking, in part because I've been sitting here feeling a little guilty. I have Dr. Levine's image in my head and feeling like I wanted to reiterate that I think the health department has done an amazing job. So what I may have said in a confusing manner earlier, but you know, certainly what I intended to say was, in our communications directly with Dr. Levine and his team around particular incidents or around particular cause for concern in our community or Southeastern Vermont, we've had nothing but responsiveness and professionalism, and you know, I am completely satisfied with the way in which he and his team have served us in those moments. And separate from that, I have not found the website or, you know, other means of obtaining information about what's going on with the virus to be helpful. And so we in Brattleboro instead have been relying on the CDC site. And, you know, we've discussed already in this meeting the shortcomings of that.
All right, thank you.
Karen.
So I would echo the comments that what we've heard is that the Department of Health and Dr. Levine have been very responsive when there's issues or questions asked. The website, my understanding is what Senator Rom Hinsdale's interested in is getting more current data on a day-to-day basis for individual towns and cities. And to the extent that that could happen, I think it would be helpful. More data is better. But the other, just with respect to VLCT consulting on that, I think we'd be happy to have conversations about it. But our IT people are not me, and our IT people, they don't generally direct how state agencies manage their websites, so that you might inquire of them, but I think that would be the extent of it, and they may have some good advice.
I didn't even mean with your IT folks. I kind of meant with your members, just putting them in a room with digital services to say, how could we present this in a way that's much more user-friendly and helpful to towns? That gives them the information they need to make better policy decisions.
Okay, all right.
So when I'm looking at this, I'm looking at that there are three questions in my mind. One is, as Carl pointed out, he feels that county data is more important and that needs to be as up to date as possible. And then the making the that part of the website easier to use and easier to understand and more in line with the CDC. And then the third thing that I'm hearing, and I still haven't figured out where we are on that, is to make it more current on a day-to-day basis. And I don't know what that means if we're asking for, because I don't know how the Department of Health, how many days it takes them to do the thing that Kendall was talking about. Can they really not give with any certainty information in less than 3 days because of the way they need to look at it? Or can they do it every single day for that day or for the next day? Or does it take them a week? I don't know that. So I don't know what more current on a day-to-day basis means. That's just a question that I have, because I don't know what it takes them to get all that information and to get it so that it's really good information. I don't know what CDC, when they're reporting, are they reporting everything when they report for today, are they reporting everything from yesterday? But they can't be reporting everything from yesterday because they haven't gotten the information from the Department of Health yet. So
what I see them reporting is transmission trends.
Yeah.
They just say this county is high
Right.
transmission. Here is what you should know about that. That, I think what Carl was saying is that is pretty disconnected from towns looking at their information vis-a-vis the county, vis-a-vis the transmission rate.
So they're doing it. And where are they getting their information? CDC? From the state?
I don't want to answer it. I don't want to try to
I
answer
mean,
that
do
one.
we know where they're?
I'm sure that's where they're, I mean, I just think we're all giving our information to the Vermont Department of Health to, hospitals are, individuals are, that's who I see as the data clearinghouse right now, but I don't want to say anything incorrect.
So the information that the CDC has is not more current than what the Department of Health has. It's just that you can't understand the Department of Health's information. Is that what I'm getting really confused here about that. And I know we don't have to vote on this, but I really want to understand this before we go to the floor. So Carl, did you?
I don't have an answer to your question, but I have an additional complication that you can use when you're trying to get somebody who knows the answer to reply. A couple months ago, I had occasion to try to track down what the vaccination rates were. So it's a different question, but vaccination rates in Washington County. And what I found from the CDC website for a couple months ago, 2021, was that they were, I forget the exact numbers, but 44%, 48%, something like that. At the same time, the Vermont website Department of Health website was showing something like 86% vaccination. And these were exactly the same numbers described, the percentage of the population over the age 12 who'd received one or more doses, I believe, but wildly varying numbers. And I never did get to the bottom of why that discrepancy, but it shows you the kind of discrepancy that can appear between the two websites.
And they were collecting the same information. I mean, there wasn't the issue of different zip codes and different addresses and all that.
This was at the county level, and
Yeah.
the information was described in exactly the same language, and it was off by 40 percentage points or so. It was differing in 40 percentage points.
And where did they get their information, each of them?
I can't answer that question. I'm just putting this out there to let you know, this is a question that I've had about the two websites at the state and CDC level, something for you to think about as you talk to people here in the state level about their data and where they come from and how the CDC gets their data. No answers, just more questions. I'm afraid.
Thank you for that. We want answers. Yeah, I don't know. I think that what might be helpful here, I just got an email from Karen LePan in the Department of Health, and she said that they are out straight today. There is no way they're going to be able to get here, and that she'll get in touch with me later today. So what I would suggest maybe is that we have a list of questions that we can ask them to get, so that we can have a better understanding of what this is and how it would impact them and how it would help the communities. Does that make any sense? And then if I get any answers to that, I'll just forward to everybody.
I don't know which is easier, if it's a both and, but I would think Karen or somebody might just watch this half hour or, of testimony, and
that might be easier. I'm not going to presume to know that she has the half hour time to watch us. I don't know what people's time is. I mean, if I had to watch another half hour of something today, I simply couldn't do it because I have work appointments and physical therapy appointments. And so I mean, she could do that, but I think it would be also helpful if we sent her a list of some of our concerns and questions.
okay. Do you have the amendment to send her? Or
Yes, and yes, we will. I think actually I forwarded that to them when I asked them. I'm not sure, but I meant to, and we'll forward the amendment. And but our main questions are, how long does it take them to get the the information that they can report, right? Isn't that a question?
Sure. Yeah.
Okay. And then how often do they post that once they get it? Do they post it right away, or do they wait and post things once a week? Or so how often they report?
What are the barriers to integrating town, county, and CDC information with the same time frame and trend lines? I don't know if you got all that. What has been their user experience? Who do they get feedback from on how their data is reported so that they can continually improve it and make it more user friendly?
And Jeanette, I think it's important to just preface it by saying we're trying to make your information more useful to the towns which will be making those decisions. Yeah.
Right. No, I think that's we're not trying to make their jobs more difficult or anything. We're trying to
trying to make their information more useful to the towns and to Vermonters.
And I think that Carl's question about the disconnect with CDC, how does that happen? If they're collecting the same information and getting it from the same source, how does that kind of thing happen? I don't know that. I have no idea why that would be.
Right. How can they make CDC guidance more present when you're getting town and county information, so that you can link transmission rates to best practices?
Yeah, and that question that Carl raised about the vaccine rate, I have no idea how there would be such a discrepancy there. But if it were me looking at this, I would trust the Department of Health information before the CDC information, just because the Department of Health has a better handle on what our counties are and where they are. I don't know how CDC collects their information on that. So, but I think we should understand why there would be that kind of discrepancy.
You could even ask, where do people report data discrepancies or get better information? Like, is there somebody they can talk to?
I am also happy if, in terms of, because this Senator Ram Hinsdale, it's going to take me a while. So
Okay.
If you feel more comfortable forwarding the questions, because you have the intent of the amendment more clearly in your
Yeah.
head than
I mean,
do.
I'm just going to go back and review this tape, honestly, and write these down. So I'm happy to do that. If
Okay.
Jeanette, I'm also happy to have you take the lead, but I can do that as well. I'm just in transit this
I'm
weekend.
very happy to have you do that, or to send me some of the things and then I'll flush them out, or whatever you want to do. But I will send you Karen's contact information.
Okay. Appreciate
Okay.
that. I'll copy you anyway. And
Okay. All right. Does that make sense, committee? Unless somebody else also wants to jump in here. Allison, I don't know.
No, I think that, I think if Keisha is willing to do that, it's 10 of 8 her time. So I don't know what but I think that would be great if we could get, if Keisha, I mean, I'm happy to help in whatever way I can, but I think you've got it. Thank you. And I think you hear Carl and Peter. I think we need to make this data more user-friendly and more useful for our towns.
And I think that, so this will, the information that we're going to gather will help inform 30 people on the floor, whether they should support this amendment or not. And then you can look at it and see if it is actually written the way you would finally want it written. And I think that's where we are, right? And each of us, if we want to, are free to try and scour some of this information and find out how it works. I still am wondering about the address and where you live. And I tried to go in and see if you actually give your residence or your mailing address. And I believe when I took my COVID test the last time, it asked me my address.
Right.
And that was for insurance information. I don't remember giving them my town of residence.
Right. And it would be, yes, you're right, because it needs to be your physical address and not your mailing address. That's critically important.
I mean, we can't get that straight for elections. Oftentimes.
We can't get it straight when we are getting people to register to vote.
That's what I meant for elections, that we have people who try to vote in Putney because their mailing address is Putney. And they always thought they lived in Putney because that's their mailing address. So. Okay, where are we here, committee and others? Oh, Carl, you have your hand up again. Sorry.
Yes, ma'am. So I thought it would be very quick for me to send to the committee a few URLs and screenshots from the CDC website showing what would be helpful to me with Vermont data. Given the short time frame, what's the best way to get that to you all?
You can send it. You can just put our emails in your address and.
Okay, just send it to you individually. Okay.
I think so. That makes.
Send it to Gail too. Yeah. Okay. Very good.
Yeah.
Thank you.
anything else? Where are we? Anything else we need to discuss about the bill or the amendment or?
And I know the other amendment we can anticipate is taking out the 30 days. So we should think about its that value and how that ties into or not to the pattern of the emergency orders and the ease with which towns can accomplish that. It sounds like most towns meet twice a month. I know my town does. So we should think about that because that will be being asked of us.
Mhm.
And we should have a response, Madam Chair, as you already have.
Well, I will have my response. It may be different than Brian's or Anthony's or Keisha. I mean, it's not going to be a response from the committee. It's going to be what we heard, but it won't be a committee voted response.
Right. And I think I believe it was Carl who has the biggest concern with the April 30th, with the April deadline.
Yeah,
that right?
Which we can deal with in January or February. Okay, anything else that we need to?
No,
Keisha?
Also here.
I'm writing this email. Sorry.
Okay, no,
So,
that's fine, that's fine, yeah. And, okay,
You want to send stuff to me and I'll.
yeah, I will do that.
Peter, I don't know if you have my email or.
Oh, yeah.
We can aggregate.
Yeah, Peter and Karen, Carl, feel free to throw your comments in or questions.
Mhm.
Okay,
It's carried on at lunch.
all right. Anything else?
No,
Thank you.
this
Can
has been,
I want to, oh, go ahead.
I think this has been very helpful for all of us.
And I will, to Representative Gannon and Representative Copeland Hanses, thank you for joining us. And I don't know if you think our committee process is pretty chaotic or not, but we do try. So.
That we don't need
Thank
to
you.
apologize to the House.
Thank you, Senator White, for letting us sit in on this. It's been interesting and very helpful for us to get up to speed ahead of our committee deliberations on Monday.
Yeah, I think that was a good thing. Good suggestion of yours. So, okay. In that case, I think we'll say goodbye and we'll see everybody either virtually or in person on Monday, and thank everybody for being here. It was helpful to have this discussion, and